And my colleague Linda is also on the call and she can help field questions. So our presentation today, we are going to look at what is public data and why would you maybe need to use it. So public data is free data that anyone can access, reuse, and redistribute. And there are many different reasons on why you may need to access public data for your daily work. So for one example, maybe you are looking to launch a new diabetes prevention program. Well, you would want to know the prevalence of people in your area who already have diabetes or those that have risk factors that could lead to diabetes, then you know where your outreach would have the most impact. So what we're going to do is we're going to go through some common questions that you may have on accessing data and go through an overview of local resources specific to Allegheny County. Okay, so our first question is, where can I find interactive dashboards of data? So one of our first dashboards that's interactive that you can access is from the CDC, and it's called CDC Places, and they provide chronic disease data such as cancer, high cholesterol, kidney disease, diabetes, heart disease, obesity, and you can access that all in an interactive dashboard on their website. So the screenshot shows diabetes across Allegheny County. And as you can see, like the darker areas would be the higher prevalence. And if you look at the top of the screen, let me get my laser here, you can see different outcomes and you can just toggle between them and the screen will change. So if you're just looking like real quick that you want to see like what is a specific area, you can go on here. So this screenshot shows I searched the Hill District. So this now shows diabetes prevalence just across the Hill District, and you can click on specific census tracts and get that prevalence. So this specific census tract that we looked at says that 28.4% of adults in this census tract have been diagnosed with diabetes. So that's a quick way to get information. And CDC Places also has other features as well. You can download data, raw data off their site, which then you could use to make your own figures, your own graphs, maps. And they also have a feature on their website that you can compare different counties. So you could compare Allegheny County to, say, the county in Cleveland, and then that compared to the US. And all of the links we will provide you guys at the end, then you guys can kind of, the goal is that you guys can go explore these on your own. Okay, so another interactive dashboard that is specific to Allegheny County is our Allegheny County Overdose Dashboard. This is pretty new, so some of you may not have heard of this at all yet. So it is on our Allegheny County website, and it has 6 tabs that you can switch between up here at the top. And it's a home page, then they have a data and definitions page that is very helpful, and then fatal trends, fatal details, overdose trends, and overdose details. So this screenshot shows the overdose trend and the overdose detail pages, and you can hover over the numbers, graphs, and the map, and everything will bring up more information. So that's a really cool feature of this. You can click anywhere on these graphs and it will tell you the percentage or point of time. So these can also be downloaded straight from the website as an image, a PDF, or a PowerPoint. And the PowerPoint feature will actually download these images that are on that show here across all of the tabs. You could have a quick presentation of the most recent overdose data. And as you can see, there is information on demographics, so female, male, age, and they also have location. So another question we have is, where can I find daily updated data important for my community? So the Allegheny County COVID dashboard, which many of you have probably seen, is updated daily. And just like the overdose dashboard, you can hover over the graphics for more information, toggle between the different tabs at the top here, and download these images straight from the website. So the images that are shown on the screen, anyone could download those and have those again as an image or a PDF, and I believe a PowerPoint as well. And so The first image shows the COVID-19 overall in the county by looking at cases, tests, deaths, and hospitalizations. And then we also have rates by demographics. As you can see, the second picture here shows the 14-day PCR positivity test by race and ethnicity. Another dashboard that Allegheny County has that's updated daily is the Air Quality Index. The Air Quality Index is used for reporting daily air quality for people to understand how clean or unhealthy the air in their community is. And just like the other Allegheny County dashboards, you can hover over the graphs again for more information and toggle between the different tabs and download these images as well. So I downloaded this on the 2nd at 10 a.m. and it was our fine particulate matter was 48 and it's in the color green. So as you can see, that was a good air quality index. So that's something that you could check daily just for yourself to see what the air quality looks like that day. And we also can look at ozone and sulfur dioxide. And then this is the first picture is daily and the second picture is showing over time. And again, you can go down here and hover over and look at any of the rates over time. So next question we have is, where can I query health data by location, time, race, age, or sex? So EDDI is an interactive health statistics tool by the Pennsylvania Department of Health, and you can customize data, tables, charts, and maps for various health-related data. It was developed to empower public health professionals by enhancing and expanding upon their ability to use data to drive public health policy and program decisions. So this is what EDDI looks like when you go on the Pennsylvania Department of Health website. And as you can see, there are several different categories of health that you can query and export as a table, chart, or map. So we're going to go through just a quick example on this if we would select. So we selected cancer incidence for a county, state, and for a table. But as you can see, there's several different categories. We have the behavioral risk factor surveillance system, birth defects, infant deaths, children less than age 5 living in poverty, childhood lead poisoning. So really every health outcome that you could think of for the state is listed on here and for the county. So we selected cancer incidence. So this is what would come up. And so here I've selected breast cancer in Allegheny County specifically for 1 year, 2018, for females, looking at white and Black females of all ages. And so this at the bottom shows, it got cut off there a little bit, apologize for that, but this is what would export when we hit create table. So this exports exactly what we picked. So it's showing the age-adjusted rate for white and Black females in Allegheny County in 2018 that had breast cancer. And so you can make your own tables and then just download those tables off of EDDI. So our next question is, where can you download community level specific data? So we have on our website, Allegheny County Indicators. It's an interactive dashboard that can be found on our site as a resource that allows users to explore data on different public health topics, and it's pulled from various data sources. So some of the data sources I already spoke on, we also have pulled from that are on this site. So Allegheny County Indicators allows users to see how Allegheny counties and its municipalities, neighborhoods, zip codes, and census tracts rank compared to county, state, and national health data, and key areas such as access to care, chronic disease, mental health, maternal health, and the environment. So this first screenshot shows people with health insurance, and the measurement period is 2019 in Allegheny County. And so if you look down here, it says that 94.9% of adults in Allegheny County have health insurance. And it's showing how we compare to other PA counties, other US counties, which we are both in the green. And then if our trend is increasing or decreasing, so we are increasing our health insurance. And then this is showing as if we have reached our the Healthy People 2020 targets. And for 2020, the Healthy People 2020 target, which is a national target, was 100%. So we didn't reach that, but we are on track for the Healthy People 2030 target. So the second screenshot shows now adults with health insurance by race and ethnicity in the county. And there's also other graphs here you can see that you could select. So I could have selected this by gender and changes over time. And so down here, it says download Allegheny indicator data, and that is where you can download the raw data for the county and the state into a CSV file. And then you could use that to make your own figures. So this specific measure does show just county, so you couldn't, this one, we couldn't download as zip code or municipalities, but other health outcomes might have zip codes available, municipalities available, but they might not have the data by race and gender. Just because everything is pulled from different resources, it depends, each indicator is going to be different on what's available. So like I said, the last example just had the data available for the county, but this example has the data available to download by census tract for Allegheny County. So as you can see, this shows the map of adults with diabetes by census tract, which this map can be downloaded straight from this site as well. So you could use this map for anything that you needed that was relating to diabetes. And this shows the export of the census tract, the source, the measurement period, and the percent. So as you can see, this came from CDC Places, which I mentioned earlier. So you could get this information from either of those sites, whichever one you would prefer. So next we have, where could I find data on human services and other non-health related issues in my community, since we've been talking mainly just about health outcomes so far. So Allegheny County Analytics is from the Health and Human Services Department, and then you can find data on various topics such as aging, basic needs, behavioral health and disabilities, children, youth and families, crime and justice, education, independent research and reports, and innovation and reform. And so this example that I have here shows the older adults protective service program dashboard. And so the flowchart below describes in which a case is initiated and handled in the older adult protective service program, starting from the call that was made and through the case closure. And so depending on which category and data set they have, some are interactive dashboards and some are data that you could download. And another resource that you can find information that's not just health related is the Western Pennsylvania Regional Data Center. And they provide a shared technology and legal infrastructure to support research, analysis, decision-making, and community engagement. And it was created in 2015. There's 331 data sites on this website that you can access across categories of just general demographics, civic vitality and governance, education, energy, environment, geography, health, housing and properties, human and social services, public safety and justice, recreation, and transportation. So some of the sites that are listed on here overlap with other ones that I've already said, but just another way that you could access them. So depending on the data here again, it may be an interactive dashboard or just might be data that you can download. So this example is the 311 data. So this data shows the 311 service request in the city of Pittsburgh. This data is collected from the Quest intake software used by the 311 response center. And then those requests are collected from phone calls, tweets, emails, a form on the city website, and through the 311 mobile application. So I went through and downloaded on the website. You could filter what information you wanted to see. So I just picked the neighborhood, the department that it was, who handled it, and what the request type was. And there's a lot of other options that you could get information on with those calls. And then you can just download that again straight from the website into an Excel file after you sort it. And so this shows like we had a street obstruction enclosure that someone reported in the central north side, graffiti in the south side flats, littering in Troy Hill. So that's kind of just an example of different information that might be important that you might want to know working in a different community that's just not health related. And so this is the list of the data source list of the websites that I just went over. So we encourage you to go and look at all of them. And then if you have any further questions and you want to learn more about a specific dashboard, we are happy to help with that. And then we also put a couple more of the COVID resources on here, vaccination rate by school and the COVID vaccination report, in case anyone was interested in those. And then here's my contact information. So feel free to email me with any questions that come up after today. Thank you.
So this is Hannah again. I actually have a question I'm going to ask, but I wanted to open it up for questions that people have. We certainly have time, and it seems like a manageable group to have questions. I'm going to ask my question first just to get it started, but I don't want to monopolize this at all. I think, Samantha, one question I have is, how do you pick which resource to go to? If you could give some kind of thoughts about that, kind of thinking about like the Allegheny County dashboard versus and the Western Pennsylvania Regional Data Center. Can you just talk through, some advice you might have for people like me that aren't working with data every day in terms of which resource to go to?
So I think it's a personal preference, and Linda can chime in because she's used these dashboards a little bit more than I have. But like if you're looking at, like I said, CDC Places has the same information we pulled from them that we have on our dashboard. The CDC Places one might be a little bit more visually appealing than, say, the map that was exported that I showed on ours. So I think it's all comes down to kind of your personal preference once you kind of play around with them. If you're not really sure what you're looking for, I would say you want to go to like the Western Pennsylvania one because they have a lot of options, or the Allegheny County indicator site on our website. And then you can always go from there. It says the source, and you can always then go to the direct source website.
And I'll just sort of build off of that. I think definitely agree with you, Sammy, when you were saying a lot of the between our site, the state site, and CDC, we're all using similar data, but it's sort of presented in different ways. So if you want to sort of download census tract data to create a map, I think the CDC website and our website are probably the best places to go. If you're looking for several years of data by a particular subgroup, whether that be age or sex or gender or race, I think the state website is probably the best way to do that. And then sort of how WPRDC ties in, I just sort of see them as, the sort of one-stop shop for any data set that you're looking for. So we actually provide them some data for certain indicators that's available, sort of available everywhere. It's available on WPRDC, it's available on our website. It might be available, in other locations like on the state website. But I think if you're sort of looking at, where can I just sort of pull a data set on any particular topic and analyze it, I think that it's really good for that. And then of course, if you work with a particular health issue, you can, and you have something that's really specific, say you're writing a grant or something like that, you can always, send us an email and we could give you more detail on a particular indicator.
Thanks. Does anybody else have any other questions? there was a question about sharing the slides, and so Samantha, I'm assuming that we can just send these out as follow-up and in an email.
Yeah, I believe that will be fine. I can send it as a PDF to you following the presentation today.
Perfect, thanks. Any specific examples people are thinking about, or? Maria, will you just remind us which sessions we have coming up for, this is September, October, November, and December for people to look out for?
Yes, so if you guys want to pencil in your calendars, this speaker series will be the second Tuesday of every month until the end of 2021 from 10 to 11 a.m. Our next speaker will be talking about mental health, and we'll have professionals from the American Suicide Foundation. And then after that, we'll have someone from the health department speaking about health equity. That'll be November, and December we will be speaking about eating healthy on a budget. And I believe that Adagio Health will be the presenters on that one. So yeah, those are our next four. And Hannah mentioned before, we're hoping that these gain traction and that you all find this information valuable. And then we'll look into 2022 regarding scheduling more things.
Thank you. So please share. We'll send information out to everybody. Oh, Misty's asking, who should be attending these? Can we share with our families? I'll let you take that, Maria.
Yeah, I mean, so I think so. I think that anybody that can, log into these are more than welcome to come to these. I think I don't know, I guess we in our minds we are thinking about our Live Well Allegheny partnerships, but it's definitely something that could be open to anybody who you think that might find this helpful and resourceful. We're also helping. Yeah, I'll just leave it at that. I think that it'd be great for families to come to it.
And I know that Teams can be Microsoft Teams, everybody has a different platform that works. I know it can be a barrier for some people. So we do have an account that has a phone number so that hopefully it should be a little bit more accessible. The county doesn't have a Zoom account that I know of. So there is a phone number that you can share. Okay, thanks everyone. So
I see a little bit of typing. I just want to make sure we don't log off before. I will also say, while I see the dots going, if your organization feels like they want to present, like if you feel like, you want to kind of be a presenter for this in some sort of way, please reach out to us. We can, we'll definitely get you on the list. Okay, I think. Great. Sammy sent her email address, and I think we're good for today. Thank you, everyone.
Thanks, everyone. Have a nice day. Thanks, Samantha and Linda.
Thank you. Have a nice day, everyone.